Hello, and thank you all for joining us today to learn more about Medicare and Medicare insurance, because there is always more to coordinate than just a birthday party. It's my pleasure to introduce our partner and our resident expert in all things Medicare, Luann Yardberry with Higginbotham's Insurance. She's currently the managing director for the Medicare department, and we're excited to have her join us today and share a wealth of knowledge and all of the information that we need to know when planning for Medicare. Luann, thank you, and we're glad you're here.
Thank you so much for having me. So we'll just get started. Again, I am with Higginbotham. Towards the end of the presentation, you're going to see a slide that has some information on how to get in touch with me. And so please feel free, because again, this is going to be a high level presentation. So let's get started. There's 4 parts to Medicare. Medicare Part A is the hospital portion. This is your hospital stays, your inpatient, your skilled nursing, your home health care, hospice care. Medicare Part B is considered your medical coverage. That's going to be your doctor's office visits, lab work, x-rays, MRIs, CAT scans, those types of things fall under the medical portion under Part B. Part C of Medicare is called the Medicare Advantage. And then Part D is a prescription drug card. So original Medicare is your Part A and your Part B. This is going to be your red, white, and blue card. Typically, it's called original Medicare or traditional Medicare. To that red, white, and blue card, you can add your Part D prescription drug card, and you can also add a Medicare supplement or a Medigap plan. Or you can replace all of that with a Medicare Advantage plan. A Medicare Advantage plan is going to package everything together. It's going to be your Part A, your Part B, some gap coverage. Also, it's going to include some discounts for dental and hearing and those types of things. So Part A of Medicare, how do we qualify? Well, we must be 65 years old. We must be a U.S. citizen or a legal resident for 5 continuous years. The cost of Part A you have prepaid for. It's not free, you have prepaid for it. So if you have worked 10 years or 40 quarters in your lifetime, you have prepaid for Part A. So if you look at your paycheck, you're going to see a deduction for Medicare. That's Part A of Medicare, and that's what you've paid into all of your working years. Now, there are some special situations for those folks that are under age 65 that will qualify for Medicare. If you are receiving Social Security disability for 24 months, or you have been diagnosed with end-stage renal disease or Lou Gehrig's disease. The Part B premium is based upon your modified adjusted gross income. That is going to be a line item on your tax return. This is going to include all of your income, not just your salary. If you have rental income, if you have investment income, if you're receiving Social Security benefits, all of that combined is considered your modified adjusted gross income. So let's look at this chart here. Let's say that my husband and I are making, in our modified adjusted gross income, $250,000. You will see that that will be $297 for our Part B premium. Let's say that we're single and we are making, again, modified adjusted gross income, $85,000. Under that situation, we will pay $148.50. Now, in addition to the Part B premium, you will be assessed a surcharge. So again, for those folks in the $250,000 range, we'll pay $31.80. For someone in the $85,000 range, we will not be assessed a surcharge. This chart is the 2021 Part B and Part D surcharge premiums. Unfortunately, the 2022 premiums are not going to be released until sometime probably around the first to second week of November. You can find that new chart on the Medicare website, the CMS website, the Social Security website, and a lot of other websites that are available for you to search the new premiums. What we have been told is this $148.50 will probably go up to somewhere around $150. But again, that has not been released formally. So Part A of Medicare. Part A of Medicare, again, is the hospitalization. If you think of this graphic as a box and you are inside that box, that's your inpatient hospital, your skilled nursing, your home health, any blood that's administered while you're in the hospital, and then your hospice care. Your Part B your Part B coverage, again, is for outpatient surgeries, lab work, x-rays, MRIs, CAT scans, doctor's office visit. You have to go get crutches, if you have to go get a walker, all that falls under Part B of Medicare. So what are we going to pay? Well, under Part A of Medicare, our responsibility is $1,556. Now, this is considered a per admission deductible. So if we go in January, we're responsible for the $1,556. If we go in June, we're responsible for the $1,556. If we go back in September, and so on and so forth. So this is going to be your per admission deductible of the $1,556. Now, if we're in there more than 60 days or more than 90 days, they're going to assess a per day charge. It's $386 for day 61 to 90. It's $778 for day 91 to 150. There's also a copay when you go into a skilled nursing facility. What does that mean? Well, the first 20 days are going to be paid for by Medicare. So if we fall and we break our hip, and let's say that we're in the hospital for a couple of weeks, they do a hip replacement, but we still can't go home. We still need some rehab. Well, a rehab facility is considered a skilled nursing facility. Medicare pays the first 20 days. Day 21 to 100, our cost share or copay, however you'd like to look at it, is $194.50 per day. A lot of folks ask, what happens after day 100? Well, after day 100, we become a private pay patient. In other words, Medicare won't pay anything after 100 days in a skilled nursing facility. Part B, it's a little simpler. It is a calendar year deductible of $217, and then you're responsible for 20% of the remaining balance. Now, unlike the premium chart, which has not come out yet, the 2022 amounts have come out. So if you notice on this page, it says that these amounts that we will be responsible for are for 2022. What does Medicare not cover? Well, what does your group health plan not cover? It's not going to cover cosmetic surgery. It's not going to cover what we call a routine eye exam. Now, Medicare is going to cover anything medically necessary, like glaucoma and cataracts and things like that. But it's not going to cover just what we call a field of vision. You can't see, you need glasses, something like that. It's also not going to cover contacts or eyeglasses. It's not going to cover any, again, long-term care or nursing home policies. Won't cover hearing aids. Won't cover any dental care. Won't cover any dentures. And then it won't cover any what we call this concierge medicine, which is typically a provider that only accepts cash. So let's talk now a little bit about a Medicare supplement or a Medigap policy. These are meant to fill in the gaps of what Medicare doesn't cover. So if you remember one of the previous slides, I told you all of those things that you're responsible for. Well, a Medicare supplement is meant to, again, fill in the gaps or help cover those things that Medicare says is your responsibility. This is a standardized chart that is out there. So Plan A through Plan N all have to be standardized for every carrier. Now, every carrier can charge a different premium, but the plans are standardized. Then you have Plan C and Plan F. These two plans are only available for folks that turn 65 prior to, January 1st of 2020. So let me restate that. If you turn 65 after January the 1st of 2020, you can no longer purchase a Plan C or a Plan F. Right now, Plan G is the most popular plan. If you notice, all of these things are checked. So what does this mean? The only one that is not checked is the Part B deductible. So the way that this plan works is you go into the hospital, you go into your doctor's office, you go into a skilled nursing facility, MRIs, CAT scans, lab work, all of those things. Between Medicare and the Plan G, the only thing that you're out, again, is this Part D deductible down here that is $217 a year. This is one of the reasons that people like Medicare supplements is because Medicare is the primary payer of your claim. And then when you add on a Plan G, all that you're responsible for all of those Medicare eligible charges that they say is your responsibility is a one-time small deductible of $217. Part D is a prescription drug plan. There are 24 plans in the state of Texas. Each plan is going to vary by premium, by the list of drugs they cover, by the deductible, by the copays, by the coinsurance, whether you have coverage in the gap or the donut hole, and are there any limitations such as the quantity, prior authorization, and things like that. So this chart can kind of help you understand a little bit about how the Part D drug plan works. Let me first of all by telling you the drug plan is going to be specific to your prescriptions. So if you're taking 3 generics, you're going to be matched up with a particular carrier. If you're taking a combination of generics and brand name, there might be a different carrier that we recommend. And then on the high end, if you're taking specialty medications like Enrol, Humira, the higher dollar prescription medications, there may be obviously a different prescription card that's recommended on that end. So let's talk about how this chart works. So stage 1, or the first level, is called your deductible level. The carriers can charge anywhere from a 0 deductible, but they can never charge you any more than $480. Then once you've reached the deductible, you go into what we call stage 2, or the initial coverage level. What does that mean? Well, that means between what we pay and what the insurance company pays, we have a limit of $4,430. Think of the initial coverage level like a debit card. The debit card is loaded with $4,430. We go to the pharmacy, we pick up a prescription that costs $1,000. We pay a $50 copay. That full $1,000 goes towards the $4,430. So again, it's between what you pay and the insurance company pays. Once you've reached the $4,430, you go into the coverage gap or the donut hole. You stay in that donut hole until you specifically have been out $7,050. Once you have reached that limit, you go into the final stage, stage 5, or the catastrophic coverage phase, where you will either pay a small coinsurance or a small cost share. Part C of Medicare. Part C of Medicare is called the Medicare Advantage plans. This is a private insurance plan that replaces Medicare. These plans can be structured as a PPO, which means you have in and out of network benefits, or it may be staged as an HMO plan where you must stay within a certain network. In other words, no out-of-network benefits. You still must enroll in Part A and B of Medicare. You must live within the service area that you take your Advantage plan. And again, there will be some added additional extras, such as discounts on vision, dental, hearing, and a lot of these will include like some gym memberships and things like that. I want to caution you about enrolling in a Medicare Advantage plan. Again, remember that these plans replace Medicare. They are network-based plans, and you can only join or leave one of these Advantage plans during what we call an open enrollment period. Now, you can drop the Advantage plans again during this open enrollment period, and you can move back to what we call traditional Medicare, which is your A and your B, and you may be able to pick up a Medicare supplement. This is kind of where the hiccup comes in. If you have some major medical conditions, such as cancer, heart disease, things like that, you may not be able to qualify for a Medicare supplement. A Medicare supplement is going to be medically underwritten. In other words, they will ask you medical questions. So again, if you choose the path of the Advantage plans, you get into the Advantage plans 2-3 years down the road, you develop some major medical conditions, want to come back to original Medicare, you can certainly do that and enroll in A and B, but you may not be able to qualify for a Medicare supplement. Again, as a final reminder, these plans replace Medicare. So let's shift gears a little bit. Let's talk a little bit, how do we enroll in Medicare? Well, first of all, there's a lot of people out there that think that you are automatically enrolled when you turn 65. The only people that are automatically enrolled for Medicare when you turn 65 are those folks that are receiving Social Security benefits prior to age 65. So if you start taking your Social Security benefits at, say, age 62 or 63, then you will be automatically enrolled when you turn 65. If you are not receiving Social Security benefits prior to age 65, then you will have to do something. So let's say we're turning age 65 in the month of July. You have a 7-month open enrollment window. You have 3 months before the month of your birthday, the month of your birthday, and 3 months after your birthday. Again, you have 7 months considered your open enrollment to enroll in Medicare. Most folks nowadays will go online to the Social Security website or the Medicare website to enroll. A lot of the local offices are not open anymore for walk-ins. Let's say we're working. We want to keep our group insurance when we turn 65 and we want to defer enrollment in Medicare. That's okay, because as long as you have a qualified health plan through your employer, then you can defer that enrollment. But when you decide to enroll, let's say at age 70, there's a couple of forms you need to complete. You need to send those into Social Security, and they'll help get you enrolled in Medicare. You actually have an 8-month window when you leave your group insurance to enroll in A and B. However, you only have a 2-month window to enroll in the Part D. So my advice to you, if you plan on retiring, dropping your group insurance, you try to plan at least 2 months prior to that effective date. I'm talking to a lot of folks now that are retiring at the end of the year, want to go on Medicare January 1st. This is a good time of year to go ahead and enroll because it's 2 months before the January 1st effective date. So let's wrap this up with some important enrollment tips. If you have employer group insurance and you want to know whether to keep that or move over to Medicare, it is all about doing the math. Which one is going to be less out of pocket for you? If you decide you want to enroll in Part A, B, and the drug card, just make sure that you let your employer know. Because if your employer, for instance, is making a contribution, maybe into an HSA account or something like that, you do need to let them know that you have enrolled in Medicare. Remember, if you are enrolled in Social Security prior to age 65, you will be automatically enrolled in Medicare, so you don't need to do anything. Social Security will require you to at least be enrolled in Part A. So if you have group benefits, you're taking your Social Security benefits prior to age 65. At age 65, the red, white, and blue card shows up. It's got A and B. You obviously can defer B, but you must take Part A. A lot of confusion sometimes is between Medicare and Social Security. Social Security is the branch of the federal government that administers Medicare. You do not have to take Social Security benefits in order to be enrolled in Medicare. They are completely separate. Final thing I want to remind you of is if you have dependents with you on your employer group health plan, make sure you take them into consideration before deciding to drop the group insurance and move over to Medicare. Again, just make sure that you choose wisely. Here's a couple of websites. You have the Social Security website, the Medicare website, CMS, and healthcare.gov. And here's a couple of phone numbers for you. Again, to wrap it up, my name is Luann Yarberry. I work at Higginbotham. I take care of the Medicare folks. And then there's the email address and the phone number. So that wraps it up for today.
Thank you, Luann, and thank you all for joining us today.